Welcome, everyone. Before we jump into today's Quiz 5 review, I want to briefly walk you through two slides that appeared at the beginning of your module, based on Fiona's question from last week's class. The CETUS triage system and the RN to MP transition pathway. The Canadian Triage and Acuity Scale, or CTAS, is the standardized system used in every Ontario emergency department to determine the order in which patients are seen. It has 5 levels. Level 1, resuscitation, is for patients with life-threatening emergencies like cardiac arrest or no breathing, and they are seen immediately. Level 2, emergent, covers conditions like severe chest pain or stroke symptoms. These patients are seen within 15 minutes. Level 3, urgent, includes things like moderate breathing difficulty or severe pain. Wait time is up to 30 minutes. Level 4, less urgent, covers minor fractures, ear infections, UTIs, up to 60 minutes. Level 5, non-urgent, minor rashes, cold symptoms, prescription renewals, up to 2 hours. The key takeaway, CTAS is not first come, first served. Severity drives the order of care, and patients can be retriaged at any time if their condition changes. This slide outlines what it takes to transition from a registered nurse to a nurse practitioner in Ontario. There are 5 steps. First, you need an active RN registration with the College of Nurses of Ontario. Second, you need a minimum of 2 to 3 years of clinical experience in your intended NP specialty area, primary healthcare, adult, or pediatrics. Third, you must complete a master's or doctorate level NP program accredited by the Canadian Association of Schools of Nursing. Fourth, you pass the Canadian Nurse Practitioner examination in your chosen specialty stream. And fifth, you apply for NP registration with the CNO and maintain it through ongoing quality assurance requirements. Once registered, NPs in Ontario have a broad scope of practice. They can independently diagnose conditions, prescribe medications including controlled substances, order and interpret diagnostics, admit and discharge patients, and practice autonomously without physician oversight. NPs are regulated under the Nursing Act and the Regulated Health Professions Act, both from 1991. Welcome to the Quiz 5 review for inclusion and accessibility on campus. Today's session covers 2 parts. Part A is a review of the top hat activities you completed, which focused on reflective practice and inclusive language. Part B walks through all 10 quiz questions from the 4 VR scenarios. Our learning objectives today are to reflect on reflective and reflexive practice, reinforce the use of inclusive language, and deepen our understanding of disability awareness through the VR scenario questions. Please remember, Quiz 5 is due June 19th before 10 p.m. Part A begins with a true story that grounded the top hat activity in real life. 2 sisters went to a local shopping mall. One sister had been diagnosed with multiple sclerosis at a young age, a chronic, progressive disease that makes everyday tasks like walking very difficult. They parked legally in an accessible parking space and displayed their permit. When they returned to their car, they found a handwritten note on the windshield that left them devastated. This type of incident, whether through a note or verbal confrontation, is unfortunately very common for people with disabilities, particularly invisible ones. This story sets up our discussion about assumptions, judgment, and the harm our words and actions can cause. This was your top hat task. Write a message to the person who left that note. The tone had to be instructive and educational, not aggressive or shaming, but informative. As you crafted your response, there were 5 key points to keep in mind. First, not all disabilities are visible. MS, chronic pain, cardiac conditions, and many other disabilities are invisible to the eye. Second, accessibility permits are issued by legal authorities and require documented medical need. They aren't handed out casually. Third, judging whether someone looks disabled enough to use accessible parking is an ableist assumption. It implies disability must look a certain way. Fourth, accessible parking is a legal right in Ontario, not a privilege or special treatment. And fifth, words and actions toward people with disabilities cause real and lasting emotional harm. The words matter. 5.1 activity asked you to match terms to their inclusive language guidelines. Inclusive language is about respecting how individuals identify and using terminology that affirms dignity rather than defining people by their condition. Some important principles. Person-first language puts the person before the diagnosis. For example, a person with a disability rather than a disabled person. However, some individuals and communities prefer identity-first language, such as deaf person or autistic person. Always follow the individual's preference when known. Avoid outdated or stigmatizing terms. Language evolves, and using current, respectful terminology matters. Now we move into Part B, the Quiz 5 questions drawn from 4 VR scenarios. In Scenario 1, you played the role of an enrolled student who has a concussion. Scenarios 2 through 4 placed you in the roles of a professor, a parking administrator, and a security officer. Each scenario explored a different dimension of inclusion and accessibility on campus. One important tip: playing each scenario more than once and selecting different response options reveals different outcomes and deepens your understanding. If you haven't done that yet, I encourage you to go back and try. Question 1 comes from Scenario 1, where you are a student with a concussion. The question asks, when you have a concussion, cognitive stress can cause which of the following? Your options are A. Confusion, B. Inability to focus, C. Difficulty understanding what you hear or read, or D. All of the above. Take a moment and think about what you know about concussions before we reveal the answer. The correct answer is D. All of the above. A concussion is a traumatic brain injury, and cognitive stress affects multiple functions simultaneously. Confusion, poor concentration, and difficulty processing language or written information can all occur at the same time. This is why concussion management on campus involves reducing cognitive load, not just physical rest. Question 2 stays in Scenario 1. Which of the following activities can add to cognitive stress when you have a concussion? A. Cell phone use, B. Reading, C. Computer use, or D. All of the above. Think about what all 3 of these activities have in common. Again, the answer is D. All of the above. Cell phones, reading, and computers all require focused visual attention and cognitive processing, exactly the functions impaired by a concussion. Students recovering from concussions are often advised to limit or avoid screen time and heavy reading to allow the brain to recover. Accommodation plans frequently address this. Question 3, still from Scenario 1. Students with concussions should do which of the following? A. Seek accommodations, B. Push through impairments, C. Ignore returning symptoms, or D. Ignore medical advice. What's the right approach for a student navigating a concussion and their academic responsibilities? The correct answer is A. Seek accommodations. Pushing through cognitive impairment, ignoring symptoms that return, or disregarding medical advice can all make a concussion worse and extend recovery time significantly. Seeking accommodations through the appropriate campus office allows students to keep up with coursework in a way that supports rather than harms their healing. This is not a shortcut. It is the medically appropriate response. Question 4 moves into Scenario 2, where you are a professor interacting with a student who has a disability. The student says they will need to use an FM system in class. The question asks why. Options: A. It allows them to tune out ambient noise. B. The professor never speaks loud enough. C. They have hearing loss. Or D. They are deaf. Consider what you know about assistive listening technology. The correct answer is C. They have hearing loss. An FM system, or frequency modulation system, transmits the speaker's voice directly to the student's hearing aid, or cochlear implant receiver. It eliminates the distance and background noise that make hearing difficult in a classroom. Being deaf and having hearing loss are not the same thing. Many people with significant hearing loss use FM systems while still having some residual hearing. Option D is too absolute. Question 5 is still in scenario 2. Which of the following are examples of universal design for learning, or UDL, used in this course? A. Choice of evaluation methods. B. Tests that are not timed. C. Lecture notes and PowerPoints provided in advance. Or D. All of the above. UDL is a framework for designing learning experiences that work for the widest range of students possible from the start. The answer is D. All of the above. UDL is about proactively designing courses to reduce barriers before they arise. Offering flexible assessment options, untimed tests, and materials in advance are all UDL strategies that benefit not just students with disabilities, but all learners. The goal of UDL is to build in accessibility rather than bolt it on after the fact. Question 6 is a true or false question, still in scenario 2. The statement is, UDL considers the needs of students with disabilities in curriculum and evaluation planning, and this does not replace individual accommodations. Is that true or false? The answer is true. UDL and individual accommodation letters serve different purposes. UDL proactively removes common barriers for all students. Letters of accommodation address specific needs that UDL cannot anticipate for each individual. For example, UDL might provide notes in advance for everyone, but a student with a specific print disability might also need those notes in a particular format that would come from their individual accommodation plan. The two work together. UDL does not eliminate the need for individual supports. Question 7, still in scenario 2. A post-secondary teacher can do which of the following? A. Change or deny accommodations without consultation. B. Confidentially discuss accommodations to support the student's learning. C. Ask the student to disclose the nature of their disability. Or D. Discuss accommodations in front of the class. Think carefully about what instructors are and are not permitted to do. The correct answer is B. Confidentially discuss academic accommodations with the student when the purpose is to support their learning. Instructors cannot unilaterally change or deny accommodations outlined in a letter of accommodation. They cannot ask students to reveal their diagnosis. And they absolutely cannot discuss a student's accommodations publicly. What they can do is have a private, supportive conversation about how to implement accommodations effectively. Privacy and dignity are protected throughout. Question 8 comes from scenario 3, where you play the role of a parking administrator. True or false? Safe and accessible parking is a legal right in Ontario, not special treatment. Think about what you learned in the opening story and the top hat discussion. The answer is true. Accessible parking is protected under the Accessibility for Ontarians with Disabilities Act, the AODA, and the Ontario Human Rights Code. Framing it as special treatment is inaccurate and harmful. It is a legal protection for people with disabilities, not an advantage or a perk. The person using an accessible space has every right to be there. Question 9 comes from scenario 4, where you played a security officer interacting with Malik, a person who uses a wheelchair. The question asks, which ableist assumption did Malik encounter in the security office? As so, that you can control someone's wheelchair without consent. B. That a person in a wheelchair cannot stand up. C. That his female companion was a personal support worker. Or D. All of the above. The correct answer is D. All of the above. Each of these is a separate ableist assumption that Malik experienced. First, a wheelchair is an extension of a person's body and personal space. Moving or touching it without consent is a violation of autonomy. Second, many wheelchair users have some ability to stand or walk short distances. Assuming otherwise is reductive. Third, assuming that a woman accompanying a man in a wheelchair is a caregiver rather than a partner, friend, or family member is both ableist and reflects broader bias. Intersecting assumptions compound the harm. Question 10, the final question, is also from scenario 4. What were the physical barriers in the security office that Malik encountered? A. The need for wider doorways. B. Ableist posters. C. Chairs, positioned in front of the desk that blocked wheelchair access. Or D. All of the above. The answer is D. All of the above. Physical accessibility isn't just about ramps and elevators. It includes every element of a space. Doorways need to accommodate mobility devices. Furniture must be arranged to allow clear paths, and signage or materials displayed in the space should not reinforce harmful stereotypes or attitudes. Accessibility is a design responsibility, and it applies to every room, every office, and every interaction. Let's bring it all together with 5 key takeaways from this unit. 1. Not all disabilities are visible. Never judge whether someone needs an accommodation based on how they look. 2. Words matter. Use inclusive, person-first or identity-first language based on the individual's preference. 3. UDL and individual accommodations are complementary. UDL does not replace personalised supports. 4. Accessible parking is a legal right in Ontario, protected by the AODIA and the Human Rights Code. It is not special treatment. 5. Ableist assumptions cause real harm. A wheelchair is part of someone's body and autonomy. Never touch it without consent. Before we wrap up, here are your action items. First, complete the Part A Top Hat activity if you haven't already. It is due June 19th before 10 p.m. Second, complete the VR scenarios. Third, I strongly encourage you to replay each scenario and choose different options. The scenarios are designed to show you different outcomes depending on your choices. Fourth, after completing all 4 scenarios, follow the link to complete Quiz5. And fifth, your score will not be visible until after the due date has passed. Good luck, and I'll see you next time. Sorry, Mother Nature interfered with our class time.